Hi, good afternoon, everyone. This is Shaina Smith. I know that we are at the top of the hour. We're just going to wait maybe another minute or two because we did have a lot of people register for the training today. So I just want to give those folks an opportunity to log in, especially if this is their first time trying to access GoToWebinar. So we will begin shortly. Hi, for those who are just joining us, we were just waiting a few more moments in order for our attendees to trickle in. We're having a lot of attendees join us for the first time, so we just want to be mindful of that and make sure that everyone is able to access the GoToWebinar program. So we will begin in about 30 seconds. Okay, in the interest of time, I think that we are going to get started here. This is being recorded for anyone who is going to be joining us in a few moments. My name is Shaina Smith. I'm the Director of State Advocacy and Alliance Development for U.S. Pain Foundation. And I just want to take a moment to welcome you all. If this is your first time joining one of our webinar sessions, this is one of many that we're going to be offering through the Advocacy Network. We are really trying to emphasize more patient education opportunities, and one of the ways that we are doing that is through webinars. We're also going to be producing more Facebook Live and Twitter chat opportunities for all of you. So depending on what your interests are and if certain programs work, depending on your schedules or your health, please join as many of them as possible. Again, the webinars are recorded. We do have a few housekeeping items just to go over real quickly. The first one is I just want to make sure that everyone can see my screen and the title slide here. You can let me know by typing in the question panel, and that's that little question mark button that you're going to see to the right of your screen. You can also send me a quick little chat just letting me know that you can also see the screen. Okay, everyone's saying yes, and it looks good. That is how you're going to ask me a question at the very end when we have our Q&A. You're just going to use that question mark and type in a question. I'm going to try and get as many of them answered as possible. We do have a lot of information to get through and a lot of folks who are joining us today. So we may stretch the webinar time a little bit, and we may also look at having a follow-up, maybe Facebook Live question and answer session, depending on how much we get through today. All right, great. Thanks everyone for participating in the question activity there. So at the end, as I said, we'll have some time hopefully for some Q&As. Really want to give you all the opportunity to take advantage of what we have scheduled for our afternoon's training session, or this morning, depending on where you're joining us from across the country. So here's what we have on tap for today. I want you just to learn a little bit about U.S. Pain Foundation, what we're all about, and I'm going to do a quick introduction of our team members here in the advocacy department. I want to go through some of the issues that are really impacting Americans who have chronic pain conditions. We're also going to break down what patient advocacy means. I'll walk you through how a bill becomes law, more so at the state level, because that's my forte and that's what we're discussing today, but it also can relate to some degree at the federal level as well. I want to teach you how to build some really lasting and meaningful relationships with your policymakers at the state and federal level. And then we're also going to teach you how to find some educational resources on a lot of patient issues. Please don't be scared because there's a lot of terminology. I'm still learning it as we go, and we are in this together. So you do not need to feel like after today's session, you need to be an expert on these patient issues. I want you to find your advocacy path as well this afternoon, and I'm going to show you a few different ways that you can advocate really from the comfort of your own home. You don't even need to get dressed. You can stay in your jammy jams. You don't have to leave the house, and you can still have a meaningful impact. And we'll also touch base on ways that you can effectively share your chronic pain journey and your story, as well as going over some of our media policy components. So at a glance, the mission of U.S. Pain Foundation is that we are an independent 501c3, and we're the leading advocacy organization for people with pain. Our mission is dedicated to empower, educate, connect, and advocate for those living with chronic illness that causes pain, as well as their caregivers and clinicians. We're committed to also improving the lives of children and adults who live with all different types of diseases. I want you to know that we do our very best to try and improve the lives of people with pain through the different programs that we have. Particularly what I'm going to focus on today is our advocacy program. If you take a look at our impact, we have 6,400 subscribers. And those are individuals who receive our monthly newsletter updates as well as our activation alerts. And then we have over 2,000 volunteers across the country. And another impressive number is the over 83,000 annual readers of the Invisible Project magazine. Now, for some of you joining us today, you may not have even been aware that we have a monthly newsletter or the Invisible Project magazine. I will tell you that if you go onto our website, it's super simple to sign up for our newsletter. And you can also go to invisibleproject.org and see that magazine online and read some of the incredible stories that we've been able to capture throughout the years. All right, advocacy in action is a model for change. So U.S. Pain does recognize the power of one person's voice really having an impact on decisions that are made at both the state and federal level. So that's why we created the Advocacy Network, because it's specifically catered to serve our interested volunteers. Now, through this program, you as the advocate are given various necessary tools and resources that we think you need in order to really feel confident on a specific topic. We also provide information on how to share your pain journey and become the voice for those who cannot speak. U.S. Pain Foundation does take on an advocacy approach, more so I would say a grassroots approach. So our model does include 6 major steps for grassroots and advocacy success. And step 1 is really explaining the importance of grassroots advocacy. Step 2 is making sure that you as the advocate understand legislative and regulatory processes in your state. Step 3 is to discuss the advocacy priorities and strategies. Step 5 would be collaborating with others to make our message and our voices amplified and heard. And we also finally motivate our advocacy warriors on the ground to be successful in order to make that change happen. Now, this is your go-to team for advocacy. The individuals that you all see here are models that we hired to be on the slide. Of course, I'm kidding, but they are beautiful people. They all could be models. These are actual individuals that you're going to be working with throughout your advocacy journey with U.S. Pain Foundation. You'll see that we have a National Director of Policy and Advocacy, and that's Cindy Steinberg. She really spearheads all of our federal initiatives. Emily Lemiska is the Director of Communication, and she helps our department with a lot of the online engagements that you'll see online. She also will create toolkits for you, She generates social media posts and does a lot of the behind the scenes work that really keeps our well-oiled machine going. To the center there, you'll see Nicole Hemingway, our interim CEO. She really helps us with both our year-to-year and long-term planning goals when it comes to advocacy endeavors. And on the bottom right there, you'll see Stu and Ellen Smith. They manage our medical cannabis advocacy. And of course, I spearhead all of our state issues. So speaking of issues, I do want to spend a moment here just capturing some of the obstacles I'm sure many of you are familiar with, so you can gain a sense as to the topics patient advocacy groups like U.S. Pain is focusing on. So I also wanted to pause to let you all know that all of our directors here have at least one chronic pain condition. So we know what it's like to feel stigmatized. We know what it does to us to have to be on the phone with insurance companies for hours on end. We understand the disappointments when we get those denial letters in the mail, or when we have to pay those high copays or premiums, all of those hardships that really go along with being a person in pain. We understand what it's like. Now, the good news is that we're not alone when we're uniting and we're fighting for change together. So with that, let's go down the list of issues. All right, pain management. This is a big one. I'm sure you know, and that's because there's no magic treatment that's going to have us all feeling better or managing our pain 24/7. So that's incredibly difficult then for the medical field to treat us sometimes, right? And then speaking of the medical field, there's some limited training requirements when it comes to pain management, particularly for primary care physicians, those who aren't pain management specialists. So again, this just makes it difficult for them to diagnose, treat, and manage the pain that we are experiencing. Access to treatment, here I'm going to refer it to a few things. One, being able to financially obtain medications, but it's also going to refer to limits that you may have experienced. And when I say limits, that's when governing officials may tell you how many pills you can get in a month or how many milligrams of that medication you can get within that month. And then there's also forced tapering, and that's become a significant issue, I know, for a lot of pain patients. Also under accessing to treatments, I'm putting integrative pain care and therapies up here. It's another really big topic that we're trying to tackle because, as I'm sure many of you have found out, unfortunately, these options aren't covered by our insurance plans most of the time. And then medical cannabis is also on this list, just really because of the states that either are lacking a cannabis program that affords patients the opportunity to try that medicine, or states that do not consider chronic pain as a qualifying condition. And now I want to just show you this model. Please don't be intimidated. It really just depicts specific insurance barriers that U.S. Pain focuses on. So throughout the legislative session, our team is sending out alerts or written testimony to committee members, and we're asking for their support of a bipartisan and/or patient-friendly bill that would override step therapy protocols, lessen the time it takes for patients to receive prior authorization approval, also limit the surprise bills that we receive in the mail, and keeping patients stable on their medications, deterring health plans from those increasing premiums and copays, as well as eliminating bills that promote copay accumulators. Now, this is just a snapshot of those barriers to access. I won't go into detail today about each one of these specific issues. One, because you can find a lot of the information on our website, as well as the future webinars and online programs that you are going to be hopefully signing up for and registering. Okay, let's pause here. Look at the title. It says changing your label from patient to advocate. Now, I don't know about you, but I can tell you I am guilty of sometimes placing that label on myself as a patient or a person with pain instead of Shaina the mom, Shaina the animal lover, Shaina the wife, or Shaina the advocate. So my goal for all of you is to maybe if you catch yourself as the patient and you get an email from us, take that opportunity to be you as the advocate. And what I mean when I say an advocacy warrior, that's really an individual who's committed to making a difference in healthcare through the use of your personal experience with pain. So you might be asking, how can you make a difference? Honestly, your story is going to hold the power to shift perceptions and generate legislative change. I know it can be difficult and it can be frustrating at times to think, no one's listening. I've tried. I've sent an email to my legislator. He's just not getting it. The great thing is that there's just not one decision maker, but there's a whole legislature. And there's also a lot of other ways that we can help you amplify your story. So the next bullet point, how will U.S. Pain Foundation support me in my role? So you will be given tools and resources needed to feel confident, supported, and successful in your role as an advocacy warrior for our organization. I do want you to also know that all of us are easily approachable. You can send us an email anytime. We will try to get back to you as timely as possible. So don't think that you're alone as an advocate and you're just on your way and that there's nothing else that you can ask from us. That's why we are here. We're here to support you. The rules. Okay, so if you're an advocate or you're thinking of becoming one for U.S. Pain, I'm so sorry, but there are a few rules that you have to follow, and the first one might be hard, but please understand that their health does truly come first. So don't feel as if you have, we don't want you to ever feel that you've overcommitted to something that you cannot participate in. Our advocacy network was based with the understanding that everyone's coming from different walks of life. And whether that is, you're having a major flare up for a week or a month and you just need to step back, we understand, and that's okay. Please don't feel guilty. You are not going to be of any help or service to your pain community or to yourself if you're not listening to your body's signals. So that is the first rule, I am sorry to say. The second rule is for you to understand and also believe that you truly do have power in your story. It is yours and it's yours alone. You do have the ability to share that story electronically or in person, whatever is going to make you feel most comfortable. But please understand that you truly do have a powerful story and you will make a difference. Okay, it's also all right to feel intimidated because we are not all experts when it comes to public policy making or certain terminology. But guess what? We're experts when it comes to pain, right? I mean, out of everything, we know our bodies, we know what we have to deal with on a daily basis, and we know the barriers that we have to face. So you actually are an expert. And advocacy is rewarding. It's one of those, oh, I'm so sorry. I put 1, 2, 2, 3 on this slide. I'm just noticing that. Yeah, I'm just going to chalk that up to brain fog when you're working on a project and it's like 9:30 at night. So I apologize. It should be number 4. Advocacy is rewarding. And it is rewarding. The first time you do it, you're probably going to feel a little terrified, but also excited at the same time. It's one of those, you have butterflies in your stomach. You may feel like you're going to pass out, especially if you have POTS. And that's okay. I can say that because I have POTS. But advocacy is rewarding. And after you do it the first time, it actually almost becomes addicting. It's something that you look forward to doing. So what is advocacy? It's really defined as any action that speaks in favor of, recommends, argues for a cause, it supports or defends, or pleads on behalf of others. So advocacy activities, they're not just restricted for nonprofits, and they're also a great way to engage policymakers in discussions of different issues really facing our constituents. Now, a lot of our energies, of course, are focused on supporting a cause, specifically towards our community that we're serving. But overall advocacy can support a number of topics, whether that's human rights, conservation efforts, animal welfare, etc. Advocacy can also require you at times to speak up and draw attention to an issue. So with that, let's take a moment to see how decisions are made. Welcome to my classroom. It is called Public Policy 101. You do not need to take notes because this is being recorded. Okay, through public policy advocacy, you have the opportunity to impact change in your community and also across the country. So we're not expecting you to be an expert, but gaining a better understanding of the basics is certainly going to make you feel more comfortable and confident. And so this slide is just going to give you the basic 4 principles of public policy. Now, public policy is referring to a rule, a guideline, or framework that can be defined broadly. Both state and federal governments have processes for enacting and changing those public policies and laws that are affecting our health. Now, while there is a process to adhere to, it's important for us all as individuals living with chronic conditions to have a voice at the table and to make sure that the voices are heard. So that's why you'll see when we're talking about public policy, the goal really is to develop a collaboration with lawmakers. We're going to be best friends with them. Isn't that awesome? Okay, so the next few slides are going to cover the basic background on state versus federal lawmaking. And again, we're rewinding back to high school civics class. I loved civics class. So don't worry, we're not going to have a pop quiz. So it is worth mentioning there are 3 branches of local, state, and federal government. The first is the legislative branch. Of course, they are going to make the laws. I've given you some examples. At the state, it might be, your city council, and then federal, the House of Representatives. Down in the middle there, you'll see the executive branch, and they're carrying out the laws and also have the power to set budgets. Now, your executive branch could include mayors, governors, of course, the president, as well as cabinet members. And finally, the judicial branch is going to interpret the law, and that includes courts at all levels. Okay, let's break down the state legislature. I'll start off with a fun fact, and that is on average, the state legislature passes 80 state bills for every 1 federal bill that Congress enacts. Each state operates under different lawmaking process. However, there are many commonalities that exist among the majority of the states. Now, 49 states have 2-chamber legislatures. The upper chamber is commonly known as the Senate, and then that lower chamber is the House of Representatives or the General Assembly. Now, the exception here is Nebraska, which is 1 house. Legislative sessions will vary from state to state as well as year to year. For example, Texas. Do we have any Texans here? Give me a yeehaw. We operate on, well, not we, but you operate biannually. So you may be wondering why you're not seeing anything coming through. There's no alerts. There's nothing happening, but I live in Texas and I want to get involved. Use that time to meet with your state reps or maybe get engaged on some of the federal advocacy that we have going on. All right, so the governor is the chief executive of a state. They're responsible for the administration of the government. And let's go now to the federal structure. Okay, U.S. Congress is, of course, responsible for passing that federal legislation and appropriating funds for federal and a lot of the state programs that we have. There are 2 chambers there, the Senate and the House of Representatives. Each chamber does have its own leadership. They have their own committee structure and their own set of rules. Must make it super fun for Cindy, right? Now, the senator serves 6-year terms. Your representative serves 2-year terms. And each state has 2 senators representing the entire state. Now, the number of representatives is going to depend on your state's population. And it may change every 10 years or so when the census is taken. All right, let's stop here. I'm going to just have you all understand how a bill really becomes a law at the state level. I want you to understand how the General Assembly can get a patient-friendly bill to the governor's desk. So we'll start at number 1, which is that every law started with an idea. It may have been an idea from a legislator, from a legislative aide. It may have been because you went and you inspired somebody to make positive change in your state. So there are several steps before that bill can become law. Now, any legislative member can propose or sponsor a new law. They just need to push the idea, and then the idea is written as a bill. And then they can ask other legislators if they would like to become co-sponsors. So look at that. He's deciding, yes, I want to become a co-sponsor for you because I love this patient-friendly bill. All right, then the bill is introduced during a general legislative session. And then it is sent to a committee, which will study it, and they may make changes if they want to, or they see that maybe it's necessary. And those changes are called bill amendments. Committees also have hearings that you as the public can go and attend. And if the committee then approves that bill, it's reported back to where it began and its title is read again. And that's called the bill's second reading. Next, the bill is read and it's voted on. And then after both houses approve and agree, which is your ideal situation, the bill is sent to the governor's desk for his or her signature, and then it becomes law. All right, that's the ideal for patient-friendly bills. Sometimes, as you'll see here, poor little Bill, look at, he's getting thrown out. A governor can veto a bill, but state lawmakers can vote for a veto override. You don't need to understand what all of that is, but it's pretty self-explanatory when we're talking about an override of a veto. I don't want to go down a rabbit hole, so let's shift gears and talk about your right as a constituent to get acquainted with your elected officials. All right, now taking the time to learn about legislators is really an invaluable asset to your advocacy efforts at any level of government. Now, the first step is to look up who your lawmakers are and the individuals that are serving you, their constituents. Now, at the state level, you have either assemblymen and women, state representatives, and or state senators. And to look up who is voting on state issues on behalf of your district, you can use some online tools, such as the one found on the USPainFoundation.org advocacy section. You can also visit your state web pages. Now for federal information, I'm going to, actually right here, I'll pause before federal. I want to break down for you, if you were to go look at your state government website, it's not the same for everyone. So you're not just going to type in, for example, Alabama has legislature.state.al.us, but then Arizona decides it wants to be azleg.gov. So you have a few different options there. You might have to Google it. But again, you can also just go to the US Pain website. We have everything there for you. All right, federal information. You'll see here I put up a sample of this of the website here. That's just one way that you could look up who your representative is. It's alphabetized to make it extremely simple for all of you. So don't worry, they've really made, throughout the years, I've noticed that even the state websites, they've made it a lot more user-friendly. So let's take advantage of these opportunities in order to connect with a lot of our officials that we have put into office. So I want to give you examples of ways that you can really make those direct and personal connections with elected officials, just so you start to see there's really one way that you might particularly like in order to introduce yourself, but there's more than one way to make those connections and network with these decision makers and really remain engaged in the legislative process. Now, one opportunity to start fostering really meaningful connections is to start attending events that they're hosting. That can be maybe candidates who are running for office, and it's never too early to really get your foot in the door and let those candidates know what issues are mattering most to you and to ask them, what's their platform? What do they stand for? There are often a lot of meet the candidate gatherings, meet and greets during election season particularly. There's forums. Once a person has been elected, they'll sometimes do maybe an afternoon at a pizza joint, or they'll do like a morning coffee or breakfast. There's also debates when a legislator is being challenged by an opponent. There's breakfasts or workshops and town meetings. And here to the left, you'll see I provided some photographic examples of those kinds of events right here. The top left is me with Congressman Joe Courtney. That was taken back a few years ago. I was actually attending a barbecue at a home in Connecticut, and the homeowners were playing host to an event that allowed young voters in particular to meet candidates running for office. And then below that image, you'll see that is Wendy Foster of U.S. Pain. She was attending a town hall meeting that was hosted by U.S. Senator Richard Blumenthal, and that town meeting was focused on ACA repeal conversations back in 2017. Now, a few hands-on ways that you can engage with lawmakers is to also call their office. So either they're in district office or at the Capitol. Perhaps you've used bill tracking tools and story sharing tips that I'm going to go over soon, and now you feel ready to sit down with that representative or senator and really express your support or opposition on a bill. So it's very simple to plan sit-down opportunities with lawmakers, or you can actually pull them off the floor when they're in session and take a moment just to share some key bullet points with him or her. And then the last suggestion is to write emails on occasion. And I want to emphasize occasionally, because you want officials to recognize your name and what you stand behind, but you also want to respect his or her time as someone who is going to be meeting with a lot of other constituents. They have to read through a lot of policies and the like. And lastly, don't forget the power of social media. That's really a tool a lot of lawmakers see as a helpful mechanism in capturing how important an issue is to their constituents. A lot of them these days are on Facebook or Twitter, or at least one of those platforms, and some are also posting regularly on Instagram. So social media is really a great way for you to keep up to date with issues that your elected officials are prioritizing, while also really lending your voice and educating lawmakers. Now, I'm going to be giving a separate webinar on social media, so stay tuned for details on that. But for now, I want to continue with helping you learn about issues that are impacting children and adults living with chronic conditions. So now you know how a bill becomes law, a really general broken down version. But do you know how or which bills you should be paying attention to, or how can you effectively tell the difference between a step therapy insurance protocol and a non-medical switching cost-saving tactic? Don't worry, because we are here to help you. I know it sounds really cheesy, but honestly, it's true. Okay, so our advocacy section should be your one-stop shop to find out key issues that the organization and patients are prioritizing. Finding out what bills have been introduced in your state, or what specific types of bills were introduced during this legislative session, and a lot of other helpful resources. I want to mention here, it's not on the slide, but when you do sign up as an advocate, we give you a little welcome letter, and then you have access to this super secret but super awesome Advocacy Toolkit. It's a guide for all of you to use as a reference. It includes a glossary of terms and other helpful resources. So you'll just type in uspainfoundation.org/advocacy, and that's going to take you to our advocacy section on the website. Really easy, right? Okay, let's see. I want to take a moment here to show you, if you were to click on this tab, you'll have a drop down, and you can learn about key issues. You can track bills that were introduced in your state, and it's also going to allow you to see a snapshot about the advocacy team. If you click on key issues, you'll be taken to a page like this one. This is the issue of non-medical switching, so it tells you the issue, the problem, what our position is, and then down below, you can't see it here, but there's some examples of U.S. Pain efforts and ways that we've tried to engage on that particular issue, in this case, non-medical switching. So this is a really easy platform. We wanted to make it user-friendly, again, for you as a patient, somebody who's just starting out in the advocacy arena and may not know about certain issues, or you've heard of it, you didn't know it had a name, you experienced it, and now you can say, hey, I know what that is. That's non-medical switching, or that's step therapy. Know the issues, make a difference. So once you're aware of key takeaway points relating to your specific bill or topic of interest, you're really ready to take that knowledge and turn it into positive change for children and adults. So there are a lot of few things to keep in mind, however, as you are starting your advocacy journey. And the first is, please remember, you don't need to be a legislative expert in order to promote successful outcomes. Just through your personal experience, as I mentioned, because you're a person living with a chronic disease or a condition, disorder, or a syndrome, you're already coming to the table as an expert when it comes to the disparities that are existing, as well as, understanding firsthand the societal stigmas that exist, as well as the barriers to accessing effective, quality, and necessary treatments. Secondly, decision makers, they don't usually have health or medical backgrounds, so they're going to actually be looking towards you to help them understand what problems exist for people with chronic pain. So also keep in mind that the legislators really do need to hear from you as their constituents in order to gain a sense for what's important to the residents they're serving. So try to make that effort to reach out through emails, phone calls, social media. So when it comes time for them to vote on a bill, that lawmaker really has a genuine sense for how residents are feeling towards that specific subject matter. Now, advocacy methods, I know we touched on some of these methods in theory already, but this graphic here should allow you to visually see that there are a lot of different routes that you can take. Some may work better for one person, but not necessarily be a preferred method for another person. Or maybe you prefer one, but you're having a bad flare-up that day, so you can revert and flip-flop. Do one, do another, see what works for you. And once you've started to identify a lot of the key policymakers, I do recommend immediately building relationships with them through communication as often as you feel is necessary or as often as you're able to pending your health. So the four main methods here that I've outlined to building and maintaining relationships with lawmakers is through personal or group letters. Usually those letters will let them know you're in support or against an issue. Emails, social media, phone calls, face-to-face interactions are the three other ways that you can start to really engage. Again, find what works for you. And if you need to take a step back, you're usually maybe you're the person that loves face-to-face interaction or testifying, but your health just isn't allowing you to do that right then and there. Don't feel discouraged. We always have other opportunities and ways that you can engage right in the comfort of your own home. All right, so is writing a letter or sending an email your advocacy style? So if you are an incredible writer, or you just prefer that because you don't want to be that face-to-face, you don't want those face-to-face interactions, or you don't have a lot of time on your hands, this is a great method when it comes to sharing your personal chronic pain journey or experience as a caregiver. You want to make sure that whatever you're writing or typing is personal. You'll also want to include a few lines about your condition, how a particular bill would impact your daily life or the lives of someone you care for. Also make sure you're reflecting that you're a constituent by using your home address. So here are a few housekeeping rules if you're going to decide to author a letter or an email. All right, the first one is that when you're addressing mail to a legislator, the letter should have the title honorable before that lawmaker's full name. The salutation should read Dear Senator or whatever their title is. Try to keep your letter or email to one page in length if possible, but no more than 2 pages. This is a good rule of thumb because you want to captivate their attention, but you don't want to lose them. You don't want to put them to sleep. When you're closing the letter or the email, make sure you're including a request. So whether that be they vote in support or they vote in opposition to a proposed bill, let them know what you're asking of them. And make sure that you reference the Senate, Assembly, or the House bill number. So down here, you'll see that I included a few I just threw out there. These are different ways. You might want to spell it out the first time in your introduction that you are writing to them in support of Senate Bill 45. After that, you can abbreviate it to SB 45 or HB or A for Assembly Bill. If you're not sure or you've heard of something but you can't remember, send me an email. I'll help you look it up. All right, next. If dialing is not your cup of tea, if you're not a phone person like me, maybe you'll want to consider lending your voice and your personal experience as a person who faced barriers over the phone. So if you want to do that, there's a lot of opportunities where U.S. Pain will be sending you an alert, and we're going to include the phone numbers for you so you don't need to worry about looking it up. We'll also include contact information. We'll even include a sample phone script that you can consider using when you're framing your messaging. All right, so let's take a look at some tricks and best practices when you're going to dial a member of Congress or your state legislator. If you ask to speak to a legislator, but they're not there, you can also ask to speak to their aide. So a legislative assistant will actually, and I want to just tell you who a legislative aide is, there's someone who can actually help draft and edit legislation. They generate ideas for legislation. They write speeches. They can introduce legislation to a committee or legislature, such as Congress or at the state level. So your legislative assistant or aide that you're speaking to really plays a behind-the-scenes role, but it's an important role, especially at the Capitol. So you shouldn't underestimate the influence of an aide or a staffer if you can't get a hold of the legislator and you need to speak to them instead. In fact, many lawmakers are heavily dependent on these staffers to weigh in on important policies that have been introduced. They even will sometimes follow a lot of the trends and things that are happening on social media. So whether you're speaking to a legislator or their aide, make sure that you're identifying yourself as a constituent. Then you'll want to explain your views carefully. If you're speaking to an aide, ask that your views be presented to that legislator. Try to remember to be polite when making any request or expressing your position. The staffer is considered the gatekeeper and someone you'll want to stay in the good graces of. So that's why I said, please be polite. If you are sending, you can ask for a request or make a request like you were going to do in the email. And then if you feel comfortable, ask for a response. So if you're speaking to the legislator and they haven't committed yet that they'll support or oppose something, that's okay. Maybe you want to ask the aide that you're speaking with, can you just let me know, can you call me back if the legislator got my message? You don't have to, but it's kind of nice for you to keep track of what their response is going to be. And then when you're reaching out at the end of this conversation, again, just revert back to your original request, which is usually, asking that lawmaker to vote in support or in opposition of a bill. And you'll see down here that we sent or provided an example. I'm asking that the senator, or the assemblyman, or the representative please continue championing for patient-friendly legislation by supporting House Bill 63. And that was just the example that I gave you. But you're going to want to frame it something to that effect. Again, we provide you with phone scripts. If we don't, ask us for one, and I'm happy to work with you to help really put the pieces together and have you say what it is that you would like to say. This is an example of a phone script that we sent out a while ago. It may have actually been in 2017. It notes, what your support or in opposition of. In this case, it's supporting Senate Bill 526. We usually include a little narrative. Please feel free to make it personal, make it your own. Include maybe a sentence or two about how this legislation will directly impact you positively or negatively. You might want to just share what your disease or condition is. Again, make it personal if it's over the phone or via email. Okay, maybe you're a people person. If you prefer face-to-face interactions and during times when your pain levels are such that you can travel, maybe consider these types of impactful activities. Testify, attend those in-person meetings, join an advocacy day. As you may have guessed, each of these activities do have their own specific best practices, but there are several ways that you can prepare for each one similarly. So the first step you'll want to do, whether you're testifying or going to an advocacy day, is to do your homework. I know maybe you're groaning because who has time for homework? But you really need to read the background information on your issue and have some specific components of that topic that you'll want to bring to the table. So remember, you're also the expert that day, and the legislator is quickly going to learn that if you're able to recall some of your own anecdotal information. So make sure that you're sharing your personal connection or how something may impact you if you were to face that problem as a person living with a chronic pain condition. Although you also have a very short window of opportunity to speak on an issue, your personal story is honestly going to be remembered long after that meeting is over. Okay, the next point is difficult in all other aspects of my life except for patient advocacy, and that is to be on time. You should never be late for a meeting with a legislator or a committee hearing because it's going to reflect poorly on you, on the organizations that you volunteer for, as well as on the pending legislation. If testifying to speak at a hearing, you'll also want to get there as early as possible because you do need to sign up to participate in those opportunities. And you don't want to have to wait for long periods of time in order to be one of those speakers. That's especially important for those of us with conditions that may worsen when we have to sit for an extended period of time. Now, depending on the state and our on-the-ground support network that we have, we may be able to have someone sign up for you. Maybe the day before or early in the morning. It's really going to depend, and we're going to work with you behind the scenes in that if you are going to testify to see what's the best method there. We'll also tell you around what time to get there, because although a committee hearing may start at a certain time, maybe your bill is further down, but just because it's further down doesn't mean that it won't get moved up. We've had times where, you know, our bill is halfway down the agenda, so we're thinking it'll take maybe 2 hours, and if there's a legislator or representative that's speaking on behalf of that bill, they might move it up in the agenda. It's always fun when you go to testify. You just never know what you're gonna get or walk into. Okay, next, you're gonna want to bring a one-page leave behind, something that's informational, some type of document that has facts or maybe an infographic that expands why your issue is so important to you and how supportive legislation will help this community. Now, it's not a piece of material you'll have to worry about putting together, especially if you're attending an advocacy day or the in-person meetings that are either hosted by U.S. Pain or another allied group. But you should, however, print your oral testimony. See if it's possible to actually share it with the committee members during a hearing. Now, in some states, you can only pass out your oral testimony or written testimony before that hearing begins. In other states, you can only submit it prior to the hearing date itself. Don't worry, we'll figure it out with you, but you will want to have something on hand that you can pass out. This more so, again, relates to in-person meetings. And again, the host is going to provide you with legislative packets. All right. Don't skip a beat. So remember that during any of these activities, you might be asked by a committee member or a staffer a question to which you do not know the answer. You can let them know that you'll get back to them on that information and keep moving on with your points. Don't let the fact that maybe you didn't have an immediate answer bother you. If you're like me, you may have moments or several moments where you experience brain fog. So I found, honestly, no one gets offended when you note that you're going to get back to them on a question that they raised. After the meeting, do some research or reach out to us and we'll help you find that answer and any background materials that may be helpful to including in your follow-up thank you letter to the legislator. And that brings me to my last point. Make sure you're following up, especially in in-person meetings. This will come after you've directly asked that legislator for their support. If you don't ask for it, most of the time you won't get it. As I mentioned before, don't be surprised if that legislator doesn't immediately respond in person or in their email back to you that they're going to meet your request. Keep in mind that this could be the first time he or she's actually heard about this issue, so they might need some time to gather more information or read the materials that you provided to them. When leaving the meeting, let the legislator know that you are going to be following up with a letter or a call, and also thank them for that meeting. Again, there are different approaches to prepare for committee hearings when you go to testify versus when you're sitting down with just one committee member. And if advocates feel they benefit from another Advocacy 101 training that's focused just on that, getting ready for testifying or in-person meetings, I'm happy to put that together for everyone. Yay, you're famous. Now what? Okay, you're not quite famous, but it might feel like it after you've been active in your state for a while and you've started to attend these committee hearings or advocacy days, and now you're starting to get requests from U.S. Pain to engage in a media outreach opportunity, or maybe reporters are starting to reach out to you directly. So let's put the brakes on. I have to pause and say U.S. Pain does have a media policy in place, so we kindly ask that you adhere to it anytime you're thinking of acting on behalf of the organization. This allows us to really highlight your efforts, but it also allows us to help you prepare your statements that you want to put together. And it also helps our team keep track of the messaging that our volunteers are spreading across the nation. So all that good stuff. If you have signed up as an advocate, you will get a copy of the media policy. If you've never seen it before for whatever reason, or you want another copy of that, let me know. I'm happy to share it with you. Now, for the purposes of today's training, I want us to assume that I either approached you directly and I asked you to engage in a media request, or you were given the green light from U.S. Pain after you were approached from a reporter. Now, these are examples of ways you can effectively share your story, your pain journey, and have some positive impact on state and federal policy making. You can write letters to the editor. You can go to your local TV news station and be interviewed. You can participate in a radio interview, and or you can submit opinion pieces. Now, again, I'm going to be going in greater detail how you can effectively share your story during another advocacy webinar training. So I'm sorry to give you all that cliffhanger and not go into really concrete, specific details about ways to share your story today, but you'll just have to register for that webinar. Okay, I just did like an entire day's worth of an advocacy summit in 50 minutes. So I want to pause for a moment and open up the floor to all of you all to type in your questions. And we've had a lot come in during the presentation, which is great. So I just want to start going through and monitoring some of these here. Let's see. The question was, will these slides be available after the webinar? So the slides, some of them did have animations. It may be difficult for you to understand what the slide was pertaining to because of that. I can see if I can either make a copy of this and send slides, but we really more so promote the fact that all of our webinars are recorded for you all. Okay, we have the, oh yes, I did want to mention, during the beginning, our at a glance slide, we had the wrong subscribers list number. I'm so sorry. Let's see, it is 16,400, not 6,400. Womp womp. I'm so sorry. So the good news is we have a ton of subscribers. The bad news is I made a little mistake in there. So that's, I guess, another reason why I'm not sharing the slides with you immediately after this. But sorry about that, everybody. Let's see. Oh, what do you think of pursuing with legislators outside of your state? For instance, a neighboring state who has senators actively working on these issues. Okay, that's a great question. So in the past, and especially, I'll use New England as an example because I'm in Rhode Island. A lot of the states you can travel to within, 10, 20 minutes. You don't have to reside in a particular state in order to advocate on an issue. And a great example of that is also at the federal level, right? You don't have to be reaching out to a particular, if a committee chairman is in Connecticut or is from Connecticut, but you're in Illinois, you can please still feel free to engage and activate on that issue. The only exception that I will say, and I've tried to cater this so out of state advocates can participate, is an online campaign sometimes may require you to put in your 9-digit zip code. And sometimes you can't participate in an online engagement if you don't reside in that state, but we've really tried to take that option out so really anyone can engage. You don't have to live in that state, but some of the program that we're currently using, it's at times difficult to take that zip code requirement out. But that should not discourage you from, if you see something on social media and it pertains to an out-of-state issue, to retweet it. Or if you see something in our newsletter and you want to engage in it, please feel free. If you have any questions too about the way that you should frame, although I reside, or something like that, how you should be phrasing your emails to someone or maybe calling them, feel free to shoot me an email and I'll work with you. But I would say rule of thumb is to just say, although I don't reside in this state, I am a patient living with a chronic condition, and I understand the barriers that something like this has to patients within your state. So that's what I would say. So yes, engage. Okay, let's see. I filled out the form. Oh, okay. So one person said they did fill out a form. So not sure when that was that you filled it out, Beth. I do apologize that you didn't hear anything. So the way that our advocacy program sign up process works is you go online, you click on become involved or get involved, and then it gives you some options. You can sign up for our newsletter, you can become an advocate, you can become an ambassador. You fill out this, it's almost like in a survey format. You fill out a form with your basic information, and then you should immediately receive from me a welcome letter. And it's going to tell you what to expect from us, what we expect of you. It's going to have your super secret, awesome password and username to access the advocacy guide, that online toolkit I was telling you about. If, Beth, you would like to send me an email at the end of this, I'll make sure that you get that welcome letter. I'm not sure if it was just a technical issue that we were having. Let's see, someone else never received their welcome packet in the mail. Okay, so I do want to say, if you were an advocate, you may get something different than if you signed up as an ambassador. I'm going to double check to see, Brittany, if you want to, again, shoot me an email offline, I'll see if your welcome packet in the mail was shipped. If any of you, you signed up and you haven't heard from us, just feel free to let one of us know and we'll track it down for you. But everyone's going to receive something tangible and you'll receive something virtually. Let's see. Oh, Patricia had to leave, but it was a great introduction. A lot of people just really enjoyed, thank you guys, really enjoyed this. Do you work with workers' comp at all? Okay. Great question, Jessica. Thank you. So here's what I'll say about workers' compensation. If you're having an issue where maybe you moved out of state and now you're having some complications or whatever workers' comp issue you're having. So at the state level here, like what I do, I don't specifically get involved with either proposed legislation that relates to workers' compensation, and we don't provide, medical advice, but we could help you in figuring out who might be the agency within your state that you'll want to connect with to help hopefully resolve your issue regarding workers' comp. And then someone else wanted to know if there's ways to connect with other pain advocates in your area. Okay, great question. So some individuals want to be advocates, but they don't want their email and or contact information shared with everybody else. So we do keep all of your information close-chested, if you're close to our chest, if you will. We're not going to share it with third parties. But what I will say is if you want to connect with advocates in your area, there are a few ways that you can do that. We have had requests in the past where someone is having an issue or they wanted to gain some insight on maybe a new clinic that's opening up, whatever their case may be. They just moved, they're not sure what type of support systems are in your state. Then we can work with some of our lead advocates, people who have been around for a few years, attended our summits, really have a great handle on what's happening in their state. Another thing that we're going to be looking at implementing is having state-based advocacy calls, check-ins, Facebook chats, whatever platform we decide to go with. If you have a preference, Abigail, let me know. But that's another thing that we wanted to really start offering, is a way for people to start connecting with each other. Okay, so someone wanted to know, Stephanie, me as a constituent, what does that mean? Okay, great. So that means that you are an individual who is being represented by that elected official. So you reside either in their state or you reside in their particular district. That's what a constituent is. Okay, let's see. Someone wants to know where to find the recorded webinar afterwards. There are two ways. One is that I'm going to send you all a follow-up email thanking you for joining, and it will include the recorded link. You can also go to uspainfoundation.org/webinars, and all of our webinars you'll see that we've put on have been recorded, and you just click on that link and you may just have to enter your name and your email, and then you'll get access to the recordings. Will you let us know any issues going on in our state? Anne wants to know. Yes. So the first step, Anne, is to sign up if you haven't as an advocate. Then from there, what we will do is if there are issues or a particular bill that we're tracking, we will be sending you alerts, making you aware of that particular bill, ways that you can engage. We're also going to be looking at possibly putting together a monthly legislative update that might just capture a few important bills from each state, so that way you can take a look. But I do want you to know that you can look up issues on your own as well by going into our advocacy section, and we have a bill tracking component there where you can look up the issue or you can look it up by state. So you might want to take a few minutes to engage with our interactive map or to look up a particular issue and see if there's a bill that's been introduced in your state. Jessica wants to know, do I have a Twitter class? Okay, so during the social media webinar, I will break down how to use Twitter. It's going to be both entry-level social media, but also higher level media training, so that way you understand how impactful these platforms are, especially when it comes to patient advocacy groups or patient advocacy issues. Let's see, is there an out-of-state issue? Can you help us with an advocate in that? Leslie, I'm not quite sure what your question is, but I can help you with anything that's related to state advocacy, hopefully. Send me an email and I'll try to help you out. So Catherine says that she wrote to the New Jersey governor. She was on the President's Opioid Task Force's office, told me since I didn't live in New Jersey, your opinion, that the opinion didn't matter. Okay, I am sorry that you were treated that way, Catherine, and someone saying that your opinion did not matter, because that is, on the contrary, your opinion does matter. It doesn't matter where you live. You are part of the pain community. And so you, as a pain warrior, are doing your due diligence, looking out for your fellow pain warrior brothers and sisters. So I'm sorry that you had that experience, but your opinion does matter. So please don't feel discouraged. Okay, Stephanie wants to know my name and email address. I'm going to put all that great information up at the end. Let's see. Oh, Jessica signed up last night, so she's really excited. Thank you, Jessica, for signing up. Let's see. Someone has a very me-specific question. Amy, if you would like, please send me an email. I'll put it up shortly, and I can try to answer your question. Someone wanted to sign up as an ambassador. Again, go to our website, uspainfoundation.org, click on Get Involved, and you can sign up to be an ambassador and or a volunteer, an advocate. Let's see. Oh, yes, Nicole, thank you. So Nicole Hemingway is on, and she says they'll be working on making sure everything is consistent. Let's see. Do you know if you're allowed to be an advocate while on workers' comp? I know they don't allow you to volunteer. Oh, great question, Jessica. I'm not sure. I did not realize. So you have to understand, again, the issues that we focus on. Unfortunately, right now, workers' compensation is just not one of them because our plate is full. But I can try to find that answer out for you if advocating is, I'm assuming, I mean, you are an advocate for us, you're a volunteer for us. So we can find out for you. And I can, if you want to send your email, shoot me an email, Jessica, and then I'll have yours. Are minors permitted to attend or testify at hearings or bills? And that was a great question from Emery. Yes, minors are permitted to attend or testify at hearings. Sometimes, though, at the more local level, in order to participate in town meetings, for example, and or to present, that you may have to be a property owner. So in which case, my almost 9-year-old would not qualify. But a lot of nonprofits, and we do have a pediatric program as well, are active with children, and parents will ask if their child would like to participate and advocate on a particular issue. So yes, minors are allowed to attend and testify at hearings. It's really going to be your call as their caregiver and or guardian. If you feel that they are able to, either for health reasons, behavioral reasons, physical reasons, if they're able to actually attend and stay at that hearing, because sometimes, again, it can be quite a lengthy day for anybody. Can one or both be an ambassador and an advocate, or switch from one to the other? Lynette wants to know. Yes, we are working on really taking a hard look at our volunteer program and seeing, is there really that big of a difference, and can we really you're an ambassador or you're an advocate, you're one and the same in that you want to make change. In the beginning, the ambassadors really wanted to host events and circulate materials, and then a lot of them actually merged into becoming an advocate and testifying. So it's a great question, Lynette. Please stay tuned as we continue looking more at the ambassador and advocate programs. Okay, great. Let's see. Oh, let's see. Within the advocacy section, Amy wants to know, do we have access to current state legislation on the books? There's so much misinformation on what patients are told. compared to what the law actually is? Amy, great question. We don't have in our advocacy section a place where you can go and see what's currently on the books. I would recommend that you go to your .gov website and or just doing a little bit of research online and seeing if that is actually a law that was passed in your state or if something is more so a recommendation. If you have something specific though, Amy, that you're questioning, I'm happy to work with you offline and find out the answer. We get a lot of requests saying, you know, and in particular opioids, that a doctor says they can no longer prescribe or they're tapering me off because of a new law that's in place. And then we go and do a little bit more digging and we find out that's not the case. We actually had something like that come up in Connecticut not too long ago. And unfortunately, at the state level, they were circulating brochures that had some wording that was sending off some misinformation or just sending out the wrong message. So we had to work with them on that. Let's see. Jessica says, Catherine, Facebook chats would be great. Okay, so that's something that we can look at. Jessica would love some kind of tutorial for making videos, live feeds, posting to YouTube, starting a channel, anything like that. Okay. So a tutorial on how to make videos that are relating to advocacy, that might be something that we can look at. That's a good idea. So Faye, as an advocate, wants to set up a booth at a local event. Will U.S. Pain supply handout materials and advice? Yes, 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 we absolutely will. Here's what I'm going to request though. If you want to set something up at an event, let us know as soon as possible so that way we can let our main office know for shipping purposes. And depending on the event, we can send you different handout materials. If you let us know a little bit about the event, we can kind of cater your package for you. So the earlier you let us know, the better. Let's see, someone signed up as an ambassador. They were sent this email for the webinar. Should you not? Robert wants to know, should he not be here? No, Robert, you should be here. So we asked all of our volunteers to be part of this today because really patient advocacy can be, being a patient advocate can happen from, you know, whether you're an ambassador with us, whether you are an ambassador for Arthritis Foundation, whether you are a caregiver and you don't consider yourself a volunteer for any particular organization, you absolutely should be here. Okay, let's see. Someone says, thank you so much. Do you know anyone that's working on comp issues? Jessica, again, I will let you know if there are some other nonprofits. Right now, I can tell you the issues that I put on our screen today are the main issues that all of our allied organizations are working on. There may be a few specific ones, but for the most part, those are the key ones that everyone's working on right now. Let's see. Heather, you had a question about your screenshots in order to become an ambassador be used if you switch over. Yes, I believe so. Please send me an email offline and we'll make sure that everything that you had from one carries over to the other. Amanda wants to know, what are my thoughts on contacting pain management doctors directly to share experiences and to request opportunities for advocates to speak with their staff to help them understand the patient's point of view? Amanda, I think that's a great suggestion. I would even go one step further out of not only within a pain or within a doctor's office, consider going to a college, medical schools, and speaking with students. All of these suggestions are great. I do want to also say, just let us know what you're thinking so we can help you and we can highlight your efforts. We really want you to understand that we appreciate all the work that you're doing, and we want to be able to highlight that in our newsletters and all the other platforms that we have. So I think it's great if you want to ask them if you can speak with their staff to help them understand a patient's point of view. Sometimes at some doctors' offices, they'll let you, especially during Pain Awareness Month, have a table set up for the entire month. Others have just done it for a week. Some just will replenish the brochures and information and resources throughout the year. I would suggest that if you do want to have like maybe some type of informational session, that you work with that office to see what's going to be the best time for the staff that's there. Okay, what are the next steps for getting involved? Jen wants to know. That is a great question. I would suggest, if you haven't already, sign up for our newsletter. Sign up to be an advocate. Go on our website and explore the advocacy section there. Go, once you are an advocate and you get my welcome email, log in and look at the advocacy guide that we have embedded online for just you. And I think those are some great first steps and should keep you busy for a few days at least. Are we allowed to do a podcast? Robert wants to know. Robert, if you are referring to doing a podcast as an advocate for U.S. Pain Foundation, it would depend on the topic. It would depend on who you are working with. Sometimes if you were asked to do a podcast, we'll say, yeah, that's great, do it. And you can certainly say you're Robert and you're an advocate for U.S. Pain Foundation. Sometimes we'd rather or think that it might be more impactful if it's coming from you as just a person living with pain. So you want to let us know if you're going to do a podcast, if you're thinking of using your title with U.S. Pain Foundation. Okay, someone would love... okay, we already asked that question. I'm sorry. Let's see. Sorry, I'm just trying to keep up with everybody. Facebook chats would be great. Okay, someone wants to know, what are your thoughts for the CPP's and the CDC's 90 MME guidelines? I will tell you that all of our policy and position statements are on our website, and we do have one that's focused on a balanced pain management approach. So, and what I mean when I say that is just making sure that one patient population is not going to be harmed unintendedly, right, by these policies, by another patient population. Really, when it comes to the guidelines themselves, there are some areas that we were okay with and others that were not. What I'm finding at the state level is that a lot of the CDC guidelines are more so being viewed as law, and they're not. They're guidelines. But what I will also say, I'll go one step further. There are states, especially in the last 2 years, that use the CDC guidelines as the foundation to introduce state legislation, and they did pass law that does limit specific medications, specific dosages. We, as an organization, try to make sure that any reform that's being proposed and or passed does not have some harmful implications on the pain patient, and try to really have them understand that what works for one patient may not work for the other. And some patients may need an extended release, some may need, fast, and some may require a higher dosage than the other. So I hope that answers your question. Again, a lot of our positions can be found on our website. Let's see. Someone wanted to sign up as an ambassador. Certainly go to our website and you can do that. Let's see. The questions you're asking on this webinar, will the answers be on the webinar recording? Yes. So Leslie, thanks. Great question. We're still recording. We're recording until I end this webinar. So if you, please, I know I am rushing with the question portion, but we have a lot of them coming in. So you can always revert back to this. When will be the social media webinar? Stan, great question. I'm going to pull that up in a minute once we sift through just a few of these other questions. Thank you. I appreciate you waiting. Let's see. Someone has a question about the media policy. Okay, great. Send me an email offline and I will be happy to go through that with you, the media policy. Tasha, do we have any merchandise? Oh man, I love swag. So we have, everyone gets and can always receive more, the Pain Warrior bracelets from U.S. Pain Foundation. Those are the tie-dye ones. We are not currently selling any merchandise. If that changes though, it would be on our website. If you were looking for something specific that says U.S. Pain, depending on if you are attending something specific, on behalf of the organization, we may ship you out a polo shirt or something like that. Or if you're attending a Points for Pain fundraising event, for example, you might have the opportunity to get a t-shirt that way. Carla wants to know, where do we find state-specific laws about pain medication? My doctor says there are laws, so she can't prescribe pain meds. Okay, yes, Carla, I hope I answered that earlier, but if not, you can find specific laws online. If you can't find something about your specific state, reach out to me, let me know where you reside, and I will try and find out if a law has in fact been passed or if there's more so a policy in place. I want to make sure that that your doctor and you are not getting some misinformation there. Let's see. Stephanie, have we heard of Don't Painish Pain Rally? Yes, we have heard of them. Thank you. Someone has to go. Okay, so someone read about Points for Pain last night. Jessica, what a great kid and an amazing job he's doing. So that is Tyler Cashman. He is the director of Points for Pain. He started it a few years ago, as you know, Jessica, and he actually really does help as well. Truly, I mean, Points for Pain is what helps our pediatric pain program. So Jessica's talking about a fundraising program that we have, Points for Pain. If you are interested in learning about our programs, if you go to uspainfoundation.org, click on programs, you'll see all the different ones. We have awareness programs, fundraising opportunities, a lot of resources that are helpful for you. And I'm so glad, Jessica, that you took the time to read about him, because he is an amazing individual. I can't say enough about Tyler. Okay, great. So let's see. I think we're going to wrap up the question portion, because I want to make sure that you all have this. This is my email, Shaina, S-H-A-I-N-A, at uspainfoundation.org. It's on our website, so don't worry. You can always find a way to get to me. And really, I will help you with anything related at the state level. If you have a federal question, CDC guidelines, what's HHS up to? How can I get engaged? Do you have any online campaigns currently? Or do you guys have any Hill days? That is a federal issue for Cindy Steinberg, and her email is cindy@uspainfoundation.org. Stan, to answer your question, we do have a few upcoming advocacy webinar series on the books. I may try to sprinkle one in March. If not, I will do a Facebook Live or a Twitter chat. And so the first one is next month, is the power of social media. I thought that was really fitting. Amplifying your key message and reaching legislators online. I thought it was important to have it in February, because by February, that is the cutoff date for introducing legislation in a lot of states that started their legislative session earlier this month. So we're going to be using social media, and we have used it a lot in the past, to reach out to specific committees or chairmen. And I want you all to understand and to have a really great handle as to ways that you can do that and to see how it can make a difference. So I won't get into too much detail there, because I don't want to spoil it, but as soon as I create that webinar registration page, it's going to be, and it's going to live in our webinar section on our website. That was uspainfoundation.org/webinars. So go there and visit if you're not seeing or hearing anything. But if you're an advocate with us, you're going to get that invitation from me in an email at least once or twice. And then on April 25th, Your Story Matters. That's going to be helping you conquer that stigma that, it doesn't matter what I say. It's going to help figure out ways that you can share your story, as well as some different platforms to share your story. Again, that's April 25th at 12 p.m. So, that's a blank one. Let's go back to here, because that's prettier. Actually, I'm going to go here so you guys can write that down. So we are at the end. I'm going to keep the email addresses up on the screen. I want you to understand that you're not bothering us or asking us a silly question if you're sending us an email. So we are all here if you to help you feel confident, or if you have a question on something, or you would like resources on an issue. I do want to take a moment to thank our sponsor, Eli Lilly, for making today's advocacy webinar presentation possible. Both U.S. Pain and Eli Lilly recognize that patient education is the first step in helping promote positive changes, not only at the policy level, but also within one's own health journey. Also, really thanks to you guys. I mean, you were awesome. I can't believe that we had so many people here joining and recognizing that together we're creating positive changes for children and adults that have chronic conditions that causes pain. Again, today's session was recorded, so you'll be receiving that follow-up email with the recorded link. Again, you can also access this and past webinars by visiting uspainfoundation.org/webinars. So again, thanks so much to everyone. I hope that you are excited as I am that we're going to be starting our advocacy journey together. Please shoot me an email if you have a question about any of the information that we presented for today, or any information that you have about things that are happening in your state. So with that, I will say goodbye and be well.